Executive session. But we're going to call the work study session to order for April 23rd here in the Harry E. Mitchell Government Center. Due to the concerns over the COVID-19 exposure, the city has implemented measures to protect our community, including the closing of the council chambers and limiting public attendance to electronic means only. Members of the public may view the live meeting proceedings on Tempe Channel 11. Attend the meeting virtually through Cisco WebEx events by visiting tempe.gov/clerk for more information, or submit written comments via the City of Tempe's speaker/comment card on tempe.gov/clerk prior to our meeting. With that, we're now going to go to call to the audience. And I believe we have a comment card. I look over to the city clerk and I believe we have someone on the phone.
We have a speaker online.
I believe it's Miss Deborah Arteaga.
Yes, I'm here. Thank you, Mayor.
All right, you're on.
Mayor and Council, as you're aware, TCAA is Tempe's largest social service agency. We offer 6 distinct programs that currently assist over 25,000 unduplicated persons each year. This is an increase of 36% since FY 2017. Human service funding for TCAA from the City of Tempe has decreased by nearly $100,000 over that same 4-year period. The need for TCAA services has increased over the past several years, and demand is expected to multiply even more in the coming months as households are reeling from the impact of the pandemic. The city's funding recommendations for next fiscal year represent the 4th consecutive year in funding cuts, and the most significant cut will be made in the Community Action Program. This program offers homeless prevention services to keep city residents housed during a crisis. We requested an increase in CAP funds for FY21, but the recommended award will cut about $30,000 from the current contract. This will adversely impact Tempe seniors, adults with disabilities, and other adults that don't have dependent children who are facing eviction or foreclosure. It seems like an absurd time to be reducing homeless prevention funds for our most vulnerable households, especially as the point-in-time count continues to confirm that homelessness is increasing in Tempe. During the crisis, TCAA received 467 unduplicated requests for rent and mortgage assistance in a 2-week period. Our normal volumes for this time of year is about 300 requests per month. Thousands of city residents are going to be relying on Tempe nonprofits in the coming months to help them overcome financial distress related to the pandemic. Our programs are currently serving 700 newly enrolled households since March 15th. We do a good job of leveraging City of Tempe funds. They represent about 6% of our annual budget. We're aggressively pursuing emergency relief funds. We've been successful in securing 6 grants in the past 4 weeks. We're also keeping our city liaisons updated on funds that are being received through the county to benefit CAP, like a recent influx of additional utility assistance funds. We know that resources are going to be very limited in the city for residents struggling with the effects of the pandemic. There may be opportunities for Tempe to consider CARES Act funds, perhaps to supplement services such as hunger relief, homeless prevention, and intervention at this time. And some of these funds allow for greater flexibility in how they're awarded and used. Our neighbors in the city of Mesa and Phoenix have made public their CARES Act awards, and they're inviting community agencies to apply for funds for critical human service needs. We're encouraging Mayor and Council to convene community and faith partners as quickly as possible, seek input on urgent needs, and increase human service funding at this time to address these urgent needs in the most cost-effective and collaborative manner. Thank you for giving me this opportunity to comment.
Thank you, Deborah. Is there any other comment cards, Carla?
Mayor, we did receive 2 emails via council communicator. They're not on a formal card, but if you'd like, I can read those into the record.
Please.
First is from Bob Kawa. Mayor and Council, I ask that the Mayor and Council consider substantially increasing the amount available for funding human service requests. Requests for funding made in 2019 are not valid, taking into consideration the current COVID-19 environment that has dramatically increased requests for services for seniors, families, and homeless, the most at risk within Tempe. I can speak directly regarding TCAA as a board member, Community Action Program, the Primary Homeless Prevention Program, providing emergency rent, mortgage, and utility assistance to keep families in their homes. A, requested funding of $155,000. Recommended funding was $111,045, a difference of nearly $44,000 or 28%. At the time of the application, average monthly applications numbered 308. Applications have dramatically increased. 467 applications were received for the first 2 weeks of April alone. The recommended amount of $111,045 is insufficient to meet the needs at the time of the application and is certainly insufficient to meet current needs for services. I urge the mayor and council to increase its human services funding directly or by using Tempe's $506,529 HUD Emergency Solutions Grant via the CARES Act that can be used for rent and mortgage assistance. You're welcome to contact me. Sincerely, Robert Kawa, Tempe resident, board member, Tempe Community Action Agency. The second is from Mario Reese. Mayor and Council, I first want to thank you for the consistent funding that has been provided to the Tempe Salvation Army through the agency review process. COVID-19 has increased the number of homeless of all ages, youth to seniors, seeking services by more than 35% and will continue to grow. We are currently the main and likely the sole provider of food, clothing, socks, underwear, and hygiene products due to the closure of other agencies serving the downtown Tempe homeless. Our resources and people providing services are stretched to the limit. We requested funding of $40,000. Recommended funding is $28,272. In light of the circumstances, we strongly urge the mayor and council consider funding Tempe Salvation Army considerably more than the $40,000 initially requested. I want to thank you again for the support you have given the Tempe Salvation Army. I welcome the opportunity to discuss this with you. Sincerely, Major Mario Reese, Corps Officer, Salvation Army, Tempe Corps.
Great, thank you. And with that, without any other call to the audience, having submitted information, we move on to our issue review session items. And item 2A1 is going to be the Tempe Community Council's 2020 agency review recommendations. And I know we have Naomi Farrell, you, and I know we have some presenters of co-chairs with Genevieve Vega and Brandon Wiley. So Naomi, take it over.
Well, good evening, Mayor and Council. I believe Octavia was going to introduce the agency review.
Yes, I'm here. Good evening, Mayor and Council. This is Octavia Harris. I'm the Executive Director of Tempe Community Council. And tonight presenting will be Kim Vandenwegen. She's the Community Impact Manager for Tempe Community Council. Along with Kim will be Genevieve Vega and Brandon Wiley. They are co-chairs of the Agency Review Enhancement Committee. This is the governing body of the agency review funding process. Genevieve is in her 6th year on the TCC board, and she also serves as the board secretary. And Brandon is in his 5th year on the Tempe Community Council board, and he is also the immediate past president. I'd like to go ahead and turn it over to Kim now.
Thanks, Octavia.
I'm sorry, can you hear me?
Kim, you're gonna have to turn off your volume. All right, Kim. Kim's speaking, but we can't hear you, Kim.
All right. Tempe Community Council has been privileged for the past 48 years to administer and manage the distribution of human services funds on behalf of the city of Tempe through the process known as agency review. This process is truly a community-driven effort and much more than simply a grant process. TCC mobilizes interested community members who work in Tempe to bring to agency review the voice of the community. TCC works with citizen volunteers who dedicate their valuable time over a 3-month period to reading and evaluating human services proposals, interviewing respective agencies, and making funding recommendations to the City Council. This process can be complex and time-consuming. It's also eye-opening, unique, and rewarding for everyone involved. The citizen involvement in the Human Services Agency funding process not only removes the politics from the process, but it brings citizens together to become better informed about the struggles and strengths nonprofit agencies face to fund, create, and implement quality programs. TCC's mission of connecting those in need to those who care includes those nonprofit organizations, both inside and outside of the Tempe boundaries, that persistently address the myriad of needs in our community. As we speak, nonprofit partner agencies are responding to this pandemic crisis with immense professionalism, devising new ways to help our community while trying to endure the crisis themselves. School closures, job disruptions, lack of paid sick leave, mental and physical health threats, disproportionate impact on the elderly, low-income families are only a few aspects of this evolving crisis, which now must also be addressed. And this will surely add new difficulties for already overburdened systems and programs. Over the coming months, as city government struggles to keep up with community need, we're thankful to have the community partnerships with contracted agencies, the support of Tempe Community Agency Review volunteers and citizens, the Tempe Community Council Board, and Mayor and Council. Together, we have a powerful and united front to meet the demanding challenges ahead. Thank you for this opportunity to provide these recommendations. Work of the agency review directly supports the City Council's Strategic Priority 3.10. Thank you, Genevieve.
Thank you, Kim. And I personally am not seeing the slides up on the WebEx, so I don't know if they're being projected somewhere. There we go. And we're on slide 3 right now. I appreciate it. Thank you. Thanks, Kim, for your thoughtful attention and guidance throughout this process. I also want to give special recognition to the Agency Review Enhancement Committee, which is comprised of board members and community volunteers who worked diligently for 6 months to refine this process. As mentioned, this process engages residents throughout our community to participate in a rigorous and transparent evaluation in order to come to this final recommendation. This year's volunteers, who must live or work in Tempe, were comprised of a wide cross-section of individuals, including current and retired professionals from for-profit and nonprofit organizations, business owners, public school administrators, City of Tempe staff, ASU staff, instructors and students, faith community leaders, mental health professionals, and a police officer. We estimate that over 1,400 volunteer hours have been given, illustrating how committed our community is to this process. And this year, 44 agencies applied, representing 55 programs, and of those, 7 were new programs. As has been true in the past, funding requests increase year over year. The community survey was completed by 313 Tempe residents and was distributed via digital and social media. We received responses from our human services providers, city departments, and Tempe residents. And this survey on slide 4 is directed towards prioritizing funding for 6 target populations. Now, we know that human beings don't fall into population groups and that many experience co-occurring conditions. In the community survey, we asked the very difficult question of which population is in most critical need of added services. And this is what individuals taking the survey experience in their lives and from their perspective. This year, the Tempe community ranked the population groups as shown here and as follows. So we provided some data to illustrate the challenges that are faced. So in number one, homeless individuals and families, which has increased in Maricopa County for the 6th straight year. Number two, we have working poor. Currently 21.3% of Tempe citizens live in poverty. And third, we have children and youth in Arizona, which are ranked 46th out of 50 for child well-being. And number four, senior programs. Those are varied services, but one data point has a projection that shows Alzheimer's could double in the next 30 years. Number five, individuals with disabilities came in again in 5th, and 1 in 4 adults have some form of disability. And ranked number 6 here, sexual and domestic violence survivors. It's estimated that 30 to 60% of perpetrators of partner violence also abuse children in the household. So we wanted to provide some of these data points to show some of what was going on in the community and how the community ranked them. But now Brandon is going to talk us through the financial information.
Thanks, Genevieve. So here we see that the agency requests were $1,890,314, with the projected funds available being $1,182,205. So this has left a gap of $708,109. And despite this gap, we were still able to partially fund 87% of the agencies who applied along with their programs. The chart on the right shows the funding comparison between fiscal year 19-20 and this year. The general fund from the city of Tempe is $1 million. Previously, CDBG funds, which were typically around $70,000 per year, were allocated through the Tempe Community Council agency review process. But due to a recent rule clarification, HUD has provided guidance on the use of CDBG funds for transitional housing for occupancy by homeless persons and persons affected by opioid addiction. By utilizing the flexibility granted through this rule clarification, in order to provide a more focused approach to fully utilize and leverage the funding allocation for meeting the needs of the homeless population in Tempe, these funds have been allocated directly for transitional housing and managed by the City of Tempe Human Services Housing Work Group. So you'll also see here that the City of Tempe, Together Tempe funds generated from the water bill decreased slightly, more than $1,000. And this year, TCC contributed additional Together Tempe funds. And of the $35,000 through Together Tempe, 17,000 were donations received from the community, and 18,000 of those dollars were voted on by the TCC's board of directors to provide a one-time contribution from undesignated assets in order to help fill the significant gap. Lastly, the display panel revenue remains flat year over year at $93,205. In this next slide, we'll come look at the scoring criteria. So every program from each agency was scored across 3 criteria. The application score and financial review carried a 50% weight, and these were applications reviewed by the agency review volunteers. The interview letter grade was converted to a score and carried another 40%. And the final 10% was driven by the prioritization score assigned by the results of the community survey that generated one list of priorities in order of the most to least critical as determined by community stakeholders. Genevieve?
Yeah, thank you. And as Kim mentioned, during this global pandemic, the need in our community is greater than ever. And it's important to note that these applications and interviews were conducted prior to the current state of emergency. We are acutely aware that the need is always greater than the funds available, and we're extremely grateful that the City of Tempe provides generously to support human services work. Once the final scores were tallied, we held an agency review allocation and consensus meeting. And we have so much respect and appreciation for the 30+ volunteers who gave their input, recommendations, and answered a number of roll call votes to reach consensus over a 6-hour virtual call. And this was done with an agonizing objective of reducing the funding gap of over $700,000. And we reviewed 7 different formulas before coming to this consensus reduction formula. Essentially, those scoring a 74 or below were not recommended for funding. Their services were valuable, but their applications and interview could have been stronger. All the final scores, as Brendan just outlined in the scoring criteria, were converted to a percentage and multiplied by their recommended funding amount. Then, to reward those agencies that scored greater than 90, no additional reduction was made. With that final funding gap that existed after those initial reductions, agencies that scored between 74 and 90 had a calculation applied for a smooth reduction across the board. So here we have on slide 8 specific funding information, and this is available in your booklet, but you can see how the funding is allocated if we look at the self-reported categories the agencies provided at the time of their application. For crisis, total funds are $669,932. For stability, we have $152,690. And for self-sufficiency, $359,583. And then if we look at it according to the community ranked population groups, we see the direct impact city funds provided to programs serving each of these groups. So programs for homeless individuals receive $565,294. Programs for the working poor receive $223,118. Benefiting our children and youth, $132,284. For our senior community, $145,159. For individuals with disabilities, $99,980. And finally, for programs supporting sexual and domestic violence survivors, $17,370. So I thank you again for the added funding Council considered several years ago to increase agency review funding. As you can see by this distribution, that additional funding has a significant impact on these population groups. And then to move on for improvements, as we see, as mentioned in last year's agency review presentation, we identified several improvements that I'm proud to report our dedicated agency review committee made significant strides this year. We prioritized to achieve collective impact by analyzing the need and the impacts and then comparing that to the funding amount requested. We also looked for agencies that have an opportunity to collaborate for even greater impact. As an example, we're working with other agencies in the Valley to improve continuum of care services. We spent a lot of time refining the application questions for improved scoring and to uncover how agencies are approaching services through a lens of equity. The committee also worked to provide a rubric to score agency applications, financial reviews, interviews, and monitoring to increase objectivity. And we monitored programs quarterly through reporting and site visits while increasing the frequency of our roundtable discussions to provide agencies the opportunity to learn about each other's work, to share ideas for collaboration, and to discuss best practices and program innovations. And then finally, we worked to improve contract performance outcomes and indicators. We provided additional technical assistance and worked with agencies to refine their performance measurements or tools.
All right, and so it's imperative for TCC to continue to find ways to improve, not just the agency review process, but the success of programs that are funded each year. We've set several goals in order to guide us in this pursuit of continuous improvement. First, we want to improve and refine the tracking of contract performance outcomes, as well as the indicators that determine the efficacy or success of the funded program. Secondly, we want to recognize that this upcoming year is going to be unlike any prior year, and that will likely need to prioritize needs due to COVID-19 in alignment with the city strategic plan. It's unclear how much this crisis will affect prioritization next year at this time, but we expect it to have an impact. Third, we intend to monitor the programs with a specific focus on data collection and an agency's ability to properly collect and analyze data related to outcomes and their success. And then lastly, we want to continue to find ways to refine and improve the application as well as the application scoring process. And finally, we just want to thank the agency review volunteers. This process only works because these community members contribute their time, their talents, their expertise, and most importantly, their passion for their community and their belief in the inherent value of this program. This time we open up to any questions.
Thank you. Before I get to Councilmember Adams, first, thank you, Brandon, and Kim and Genevieve, Octavia, Naomi, and all the staff and all the volunteers for the work that you've done. I can't believe it's been 48 years that Tempe Community Council has been part of the Tempe fabric. It's a long-founded relationship that I hope that will continue to work together in true partnership. And as always, we really do appreciate the Tempe Community Council and how they gather a group of residents and pull them together into an agency review process. And I think Kim touched on it a little bit. This was created over 48 years ago to take the politics out of human services and having an agency review and always looking at the goals that Brandon just mentioned to help define where we're heading, I think is so important and crucial to get all the actual data and information. So thank you for that. I know that we all know this, the demand for the human services are continuing to grow now more than ever. And we all know that the demand far outweighs the needs that we have or the resources that we have. So I think we could safely say that we all agree that our Human Services Department, working with our partners from Maricopa Association of Governments, Maricopa County, obviously the Tempe Community Council, Tempe Community Action Agency, the Salvation Army, as well as Continuing Care, I think it's so important we continue to partner and work together. So thank you so much for that. And I know we have some questions. I have some additional ones, but I'm going to go to Councilmember Adams. She has her hand raised.
Thank you, Mr. Mayor. Thanks to all the agency review volunteers. We really appreciate your help. And regarding the TCAA, it doesn't make a lot of sense to me that we continue to cut their funding when they continue to have increase in demands. They serve such a large population so well and at great cost effectiveness. And I would like to have us look at increasing the funding for TCAA, especially given the difficult financial situation many of our residents are facing. I'm assuming you could hear me, Mr. Mayor.
Yep, I heard you.
Okay, so I know that's just my 2 cents about it, but I just wanted to point that out that I'm concerned about.
And we have and that's great. And that's why we have a process in place. That's really a question when we get together next time for our budget. This is why we have this at this time being presented to us. I do know, and I did speak to a couple of the TCAA board members today in regards to some of the emails that we received. And I don't know if Octavia or Naomi can address some of the questions that we received and maybe get back to us in our Friday packet if possible. I do know there's been additional funds from the governor's office that I knew that really goes towards specific shelter services like iHelp. And I knew there was some information where, and double checking with MAG as well as our own staff, it's important that all of our partners really look for funds wherever we can get them. And that being said, I do know that there's been additional funds from the governor's office that there was a timeline that was missed, but I think Naomi can touch that. We were able to work with the county to see if we could open some of that back up. So I think that's something that will help in addition to some of the funds that our partners could see. And also, I do know that there's, through the county, my understanding, Jennifer, and the rest of the council, that there's some community-based service grants that are out there. And I do know that that money specifically goes to CAP recipients, the community agency programs. So I do know that there's that opportunity out there as well. And I'm sure there's others. And I know we're going to make sure that no stone is unturned looking for additional resources. And then maybe after this, if we can have Naomi talk about the ESG funds and the restrictions that are applied to that as well, I think that would be helpful for the council and for those listening. I see Lauren Kuby has her hand up, Vice Mayor.
Yes, whoa, make sure I'm visible here. So thank you to all the volunteers having participated in agency review in the past. I know how rigorous the process is, and it's only gotten more rigorous over the years, and in discussions with some of the review members, I know that there may be more of an opportunity to expand on the equity-based metrics going forward, and I know that's something being talked about. I mean, especially we know that with COVID, we are even more aware than before of inequities in our system, and they've always been there, but we need to, looking at the future, sorry, I'm hoping I'm not, do you guys still see me? I'm getting a weird message. Okay, I'll continue. I think we should think about expanding our equity-based metrics when we look at the process going forward. And I also think there's an opportunity to give more feedback to some of the agencies, whether they're denied funds or reduced funds, that there could be an opportunity to reach out and have more discussions. Of course, that involves staff time or that involves TCC time, but I think that is also important. Can everyone hear me?
Yes, Lauren.
Can you hear me? Okay, sorry about that. But I do want to talk about, in referencing what TCAA board member Bob Kawa said, this isn't business as usual. We're not living in normal times. And we certainly need to have input from our human service partners as we explore what the aid packages are going to mean, whether it's from the federal government, from Maricopa County, or from the state. But I like what Genevieve Vega, that that agency review was not, the position we're in now was not the position they were in when they devised this process and came forward with the decisions. So we need to probably talk about whether some of these funds going out, if we need to loosen up their restrictions and allow for contract changes midstream, because there may be the funds that are going to these agencies now through agency review, we may need to loosen the restrictions on them so they can apply the resources to the direct need that the community is facing. I'm not sure if I'm explaining that right, but I think we need to talk about whether we allow contract changes to the funds that are previously restricted, but maybe we need to loosen them up a bit so they can more respond to the need that is out there. Talking about the TCAA funding and how, on the surface, it looks very bad. We reduced homelessness funding, but when you realize that actually TCAA applied for less funding, they applied for less funding, and there is a formula that agency review team worked out, and that amounted to percentage of the score, and then they took anybody under 90, they took the 200,000 gap, and then they reduced the amount by that percentage. You had to get over 90% not to have it reduced even further. So that was a thoughtful, that was considered and thoughtful. I'm hoping that we can find $200,000 in our budget, whether that comes from the federal funds coming in or from another fund, to make up for that, because that's an area where we could possibly fund agency review agencies more fully. I really want to look at that increase of perhaps 200,000. It doesn't necessarily need to be decided tonight, but I think there's a potential there to use that as part of the formula. But I know, TCC worked really hard to create a formula, and that was fair. We can't just say we have to pick one of the agency review funding agencies and decide to fund them and increase them. We need to look at all the CARE Act funding that's coming in and figure out a way where we can have our main stakeholders, our main CAP agency like TCAA, involved in that discussion. And I know we've had internal discussions about that we need to maybe have a task force that's put together where we can bring our main social service agencies together and talk about the funding, because we will have $1.5 million that's coming to us. Now, those funds are going to be very restricted. There's all these guidelines coming out. It's not as simple as dividing it up amongst agency review players. We need to really be thoughtful, and we have to follow all the guidelines. But I do hope there's an opportunity to bring not just our staff together and TCC together, but bring some of our partners together to talk about how we're going to triage these new funds. And let's give an example. Sometimes we serve first come, first serve for emergency housing, but should there be a criteria? Should we look at first come, first serve as a criteria? Should there be more urgency that needs to be expressed within the criteria? People who are more at the, the last rope, rather than someone who's got a little bit of funding to help them. So I do think when we talk about triaging, we have to talk about the most urgent needs that are in front of us. That's about all I have to say for now. But I really appreciate all the work that's gone into this. I know that that COVID-19 was not on your plate. All of you TCC members and agency review members who participated in this process is very robust. You're continually enacting process improvements, and I so greatly appreciate that, because I know that we're never satisfied with what our process is, and we're always going to improve. But I think we need to find a way with COVID to come together as a community, and we need to find a way to be proactive, not reactive, and bring our main partners together to discuss how we're going to divide up some of the care funding that comes to us. Thank you.
Thank you. Before I get to Councilmember Keating, I just want to make sure that I think we're all in agreement that we all need to work together to make sure that we are covering some of the gaps that are out there with all of our partners. And I think everybody in the council understands that that's something we need to be doing. I just want to remind my colleagues that the CARES Act funding is not on this agenda. So we can't technically discuss this, but this is something that we can bring up at the next budget meeting to have more information. Councilmember Keating? And then after Councilmember Keating, I'm going to turn to Councilmember Arredondo Savage. Councilmember Keating, you there? Okay. Councilmember Arredondo Savage, I'll go back to Councilmember Keating.
Thank you, Mayor. Just a couple things. Of course, I know everybody's always said it, and I can't say it any more gracefully, but to say thank you so much to all the volunteers that really make, agency review as successful as it is. So thank you to each and every one of you that take the time. And I know the time commitment, many of us have been involved in agency review one time or another, and it's certainly appreciated. So thank you. And it's not an easy job. And I think the COVID-19 has made it even more difficult job. So again, thank you so much for what you do. And I think too, as we move forward, what would be great to see too is, me, I'm always a little bit of a process person. It would be nice a little bit more within the presentations if we could kind of see the dollars that have been allocated and the outcomes that have been actually have attained the goals that they were intended to attain, just to make sure that, we're all holding each other accountable and the agencies are doing what we have expected them to do. Because I love your presentation, and I know you can't get too much in the weeds, but it would be just really good to see some of the great successes that our partners are having. And I certainly agree with what was said, and I know we can't talk about future dollars that may come in, but I would strongly hope, and I'm pretty confident that if there are additional monies that come to the city to help us address COVID, that we would certainly engage all of our stakeholders, all of our agencies. And just remember that too, TCC is about several agencies that really make our community what it is. So I can't be more grateful for that. And I'm confident as we move forward, working with our Human Services Department and all of our agencies that really deliver great services, that we will continue to work together to make sure, like the mayor said, we're filling the gaps. And like Lauren mentioned, that we're addressing all the agencies that provide great services. So again, thank you guys all so very much for what you do. Thank you, Mayor.
Councilmember Keating, are you there? Hey, Randy, are you muted by chance?
These young guys don't understand technology. Bye, Cracky.
Randy, she's calling you out, man. You got to jump on. The vice mayor is calling you out, Randy. I know you're on the phone, so. All righty. Can't hear you. Is there any other comments regarding this presentation? And again, thank you to Brandon, Genevieve, to Kim, to Naomi, to Octavia, and the rest of all the volunteers. It's really impressive, the leaps and strides that we've come to make sure that there's an equitable process. So, and we're going to continue to look at partnering with our partners and agencies to help fill those gaps where they are, considering the COVID-19 pandemic. And we'll have those discussions, I'm sure, at our next budget meeting. Any other questions from council? If not, I'm going to move forward. Like that. Mr. Manager, do you have any announcements?
No, no announcements, Mayor. Thank you.
I don't have any at this time. I will have some at the beginning of the formal council meeting. Our next meeting is May 14th for our work study session in 2020. With that, we are adjourned, and we'll see you right back here, the rest of the council, at 6 o'clock. Thank you.